Anorexia nervosa has the highest mortality rate among psychiatric adolescent disorders, making it a prevalent threat to young people. With research suggesting only around 46% of people make a full recovery, it is clear that improvement needs to be made in treatment. Through reviewing previous literature and providing evidence of my own, this dissertation has concluded that guidelines are being inadequately followed when treating anorexia nervosa in young people. Tragically, this has led to many avoidable fatalities, including that of 19-year-old Avril Hart, who passed away due to several service failures who were supposed to monitor her illness. Treatment guidelines available to professionals are extensive and easily accessible, so why do failures like this occur, what can be done to stop them, and how can we make sure a treatment is as effective as possible? This dissertation provides several suggestions on both a micro and macro scale on how to do this, including bridging the gap between professional and patient's foci during treatment, creating a clear and collaborative dialogue through therapeutic alliance, improving education and training to combat misconceptions and oversights, and communication through services with patients, their families, carers, and in between themselves. Although health services are under intense pressure due to lack of staffing and lack of funding, many of these suggestions can be done without much impact on this, such as the redistribution of guidelines to all services, as well as providing an evaluative audit for patients and their families and carers to fill in after treatment. Nevertheless, this strain will continue, as will the avoidable fatalities and failures, unless a move from a reactive approach, which only intervenes when crisis point is reached, to a more preventative one is made, which includes education of not just professionals but also the public on the dangers of anorexia nervosa and how it is perpetuated by external sources such as media influence, which often glamorizes it. This will in turn lead to early intervention, which can prevent the manifestation and persistence of the illness, in turn creating less strain for the individual, their families and carers, and services themselves. Therefore, the first and second-hand experience of anorexia nervosa provided by this dissertation could help to improve services both locally and nationally, as well as help to reform them in order to ensure young people with anorexia are receiving the most effective treatment possible. And this is how my dissertation can make a difference.